Good morning. My name is Dr. Jason Phipps, and I'm with Active Chiropractic Therapy, and we're located at 2275 Deming Way in Middleton, Wisconsin. You can reach us via phone at 910-391-0826 or via email at activechiromadison@gmail.com. I wanted to do a quick video today to kind of dispel any myths and rumors and anything like that regarding the two words that are making their rounds in fitness circles, manual therapy circles, be it physical therapists, chiropractors, massage therapists, anything like that, and dispel it between the two words mobility and stability, and why we treat one first and we leave one second. So here's the difference. Mobility is the way that your body moves through a range of motion. So it's simple movement pattern. It's a simple movement ability to, can you bend over and touch your toes? If you can't do it standing, can you do it seated? It's just basically checking looking at the way your body moves. Stability takes all of that range of motion that your body has, all that mobility, and it coordinates it into, it basically coordinates all that into a nice smooth movement pattern, be it the squat, be it bend over and touch the toes, be it rotation, extension, backwards, whatever that may be. And so here's the thing. Stability is a more complex thing because it takes a bunch of stuff and integrates it and makes it work and makes it fluid. Mobility is sort of our baseline. If we don't have mobility properly, stability doesn't really make a difference, simply because stability has to take all of that movement that we have and makes it basically rounds it out and makes it a whole thing. So if our mobility is lacking, our stability, it doesn't really matter. So there's a huge disconnect between those two when you have one and you don't have the other. So the reason in our office what we do is we treat mobility first, stability second in every case. And we run through a process called the Selective Functional Movement Assessment, SFMA for short. And what that whole thing does is it basically looks at someone's movement profile, the way that their body moves, and it breaks down any faults or dysfunction that they have. And we want to break that down into a mobility problem or a stability problem. And if mobility is the issue, we're always going to work that first before we stabilize. Now, if mobility is perfect and it's stability that's the issue, we're going to work on that. But the reason we work mobility first is because when somebody lacks the ability to move and they don't move well, we want to make sure that we treat that mobility first, because if we don't and we treat stability first, we're going to box them into a reduced range of motion. And over time, you see people at the grocery store that are in their 50s, 60s, 70s, and they just look like they just don't move very well, and it looks painful when they move, and you kind of look at them and you go, oh man, I hope I never look like that when I move. And it's because their mobility has been reduced. So we don't want to do that to somebody that's 22 years old and has had low back pain. What we want to do is we want to make sure that mobility is back, and then we stabilize. So we have that full range of motion, that full complementary range of motion, and then we bring stability into the picture to help them coordinate that movement. So that's our big thing here at the office, is we simply break it down. We don't make it any more complicated than, do you move well? If you don't, we work that first. And do you move well? You do move well, but you still can't do something. It's probably stability. And so we basically drive all of our treatment off. We're treating mobility or we're treating stability. In some cases, we treat both in a more complex situation. But for the most part, it's as simple as that. Is it mobility, stability? We figure out which one's the problem, and we work there. And so what I would encourage you to do is, if you're seeing another chiropractor, physical therapist, we would love to have you as a patient here. But if you're comfortable where you are, what I'd encourage you to do is, the next time that you're doing stability exercises, what I'd encourage you to do is ask the person that's prescribing those to you, you know what, do I move well before we do the stability stuff? Because if I don't want to be boxed in to poor range of motion. And that's a completely logical thing to think, because if we're boxing you in and we're making you this really tight, I think of the Tin Man, for example, not very good range of motion. He can move, but we don't want to box you in and make you really, really stiff. We want to make you fluid. We want to make you perform better, be it playing with the kids or be it going out and running triathlons. We want to help you become the most mobile and stable human being you can possibly be, and your performance is really going to reflect that. So I'd encourage you to ask those questions the next time that you're doing anything regards to stability. Just make sure you're moving properly first. Ask your healthcare practitioner to help you do that, or give us a call. We would be happy to help you with that. Again, you can reach us at 910-391-0826 or by email at activechiromadison, that's all one word, @gmail.com. I appreciate you listening, and I look forward to seeing you soon. Thanks.